Today, the 9th of September, is International Fetal Alcohol Spectrum Disorder Awareness Day. Fetal alcohol syndrome happens when a mother consumes excessive amounts of alcohol whilst pregnant, which leads to a brain disorder that cannot be cured in her unborn child. This disorder is often a result of ignorance by the mother of how what she consumes impacts on her unborn child. An unborn child is still entitled to rights, and this is a violation of their rights, as they will be born and have to live with physical and mental disabilities that will impact severely on their ability to live a full and happy life. South Africa has the highest fetal alcohol syndrome statistics in the world, with 29 to 290 per 1,000 live births versus the global average of just 8 in different communities around the country. There are 3 areas of concern that we need to be aware of in the sphere of child protection. Firstly, many pregnancies in South Africa are unplanned and often considered a crisis. Many young women are not advised about contraceptives and how to prevent pregnancy in South Africa, which results in high levels of teenage and crisis pregnancy. The Gauteng Department of Health recently announced that over 23,000 teenage pregnancies were recorded between April 2020 and March 2021 in Gauteng alone. 934 of the girls were between the ages of 10 and 14 years, raising serious concerns around incest, sexual abuse, and rape. Many of the young girls I spoke to whilst doing research on crisis pregnancy did not know how conception and pregnancy takes place. As one young pregnant schoolgirl told me, "I thought you had to have sex many times to make a baby. I didn't know it could happen after having sex just once." Most young women don't even know that they are pregnant until their baby starts to move inside them, well into their second trimester at around 20 weeks. Binge drinking is a major cause of risky sexual behavior amongst teens in South Africa. If this continues well into pregnancy, it can have a very detrimental impact on the unborn child. The second area is the impact everything you drink or eat has on your unborn child whilst you are pregnant. From conception to around 40 weeks, your baby develops completely in your womb. This is a time of growth for your child and care and preparation for you as a parent. When you drink whilst pregnant, alcohol passes from your blood through the placenta and to your baby. Your baby cannot process alcohol as well as you can, and it can have a serious impact on their development. Drinking alcohol, especially in the first 3 months of pregnancy, increases the risk of miscarriage, premature birth, and your baby having a low birth weight. Drinking after the first 3 months of your pregnancy could affect your baby after they are born, as they could develop physical, mental, and behavioral challenges, and what is known as fetal alcohol syndrome disorder. The final area of concern is the very high level of alcohol consumption and abuse in South Africa. South Africans are amongst the top 10 narcotics and alcohol abusers in the world, with an average age of experimentation of just 12 years. 1 in 10 deaths are attributed to alcohol in South Africa, which has the 5th highest consumption per capita in the world. Parental abuse of alcohol and other drugs doubles a child's likelihood of being sexually abused. And 80% of male youth deaths are alcohol-related in this country. Drug consumption is estimated to be twice the global norm. We need to start drinking responsibly as a country and avoid all alcohol when pregnant for the sake of our children. Thanks for watching. For more information, visit couragechildprotection.com. Be sure to like this video and subscribe to our Courage channel. Stay strong and take courage.